Thank you so much for attending today's webinar. I think this is the first one of the month that we do.
Yes.
We want to thank you very much. Today's webinar is on rethinking prostate cancer. We're going to talk about advanced metabolic and immune therapies that focus specifically on prostate cancer. We're going to have a brief presentation by Dr. Francisco Ben Farris, our surgical oncologist and president and boss here at Oasis of Hope Cancer Center. My name is Gaston Tesada. I'm the director here at Oasis. Thank you so much for coming with us, for joining us tonight. And we'll start with your presentation, Doctor.
Okay.
Take it away.
Well, we're honored by your presence. And so let me talk a little bit about cancer of the prostate. A few years back, maybe 10, 15 years, I usually stated that if you had to choose any cancer, the one to choose would be prostate cancer, cancer, because generally used to be a very benign type of tumor where people were diagnosed with it but rarely died of it. It's the number one cancer in men. And there are studies that show in autopsies of 80-year-olds and up that about 80% of people were found to have cancer of the prostate, and they didn't even know it. It was a very benign cancer. There were, from the beginning, since we have been able to diagnose these cancers, that there are some cancers of the prostate that could be very aggressive, but it was a rare occurrence. Nowadays, we are finding cancer of the prostate even in older people that are extremely aggressive. And this is determined by a couple of factors. One, obviously, is the pathology, where the oncologist is going to determine the type of cells that are found in cancer, and they go from well differentiated to undifferentiated. And they usually it's a mix of these cells. And there is a table or a scoring system that was developed by Dr. Gleason, and Dr. Gleason, he scores these from benign to very malignant, and it's the combination of the two types of cells, the better differentiated in comparison to the more undifferentiated. And so up to 6, it's considered to be very benign. So a score of 3 plus 3 is a cancer of the prostate that is not very aggressive, and again, that usually will not leave the prostate, and easy to treat, very, very good results. In fact, the most common treatment for this type of prostate cancer used to be watch and wait. We wouldn't even treat the patients. We would just observe the patient. Unless this tumor became more aggressive, then we would offer treatment. And it goes up to 10. So the scores 3 plus 3, 3 plus 4, 4 plus 3, and so on and so forth. And so this helps us determine how aggressive a cancer is. Nowadays, it's rare that we receive a patient even with a score of 7, which already is an aggressive type of cancer. So we've noticed a significant change. The other thing is that cancers have become more resistant to hormone treatment, hormone blocking agent. All prostate cancers are hormone dependent. They consume the testosterone that our body produces, and that is their best source of energy. And so the treatment is to block the production of testosterone. And there are other blocking agents that will not only block the production, but also are going to occupy the receptors of testosterone so that the tumor cannot take advantage of your own hormones. But nowadays, tumors are resistant to hormone blocking agents. They found a way around it. And so it has forced the researchers to find new treatments to attack these type of hormone resistant tumors. And so nowadays we have a number of targeted therapies that unfortunately are also quite aggressive and in many cases very poorly tolerated by patients. So the treatment of cancer of the prostate that used to be a very benign and tolerated treatment has now become a very aggressive and not well tolerated treatment. So cancer of the prostate has dramatically changed, and we have adapted to that as well. And so we have a much better approach to address these changes with immunology. And so our impact protocol has made a tremendous change. Now, Gaston and his team have now developed a brochure talking about this impact protocol. And impact stands for Immune Personalized Autologous Cell Therapy, based on dendritic cells and other cancer-attacking cells from our immune system. And this protocol has helped us tremendously to use therapies that are not so aggressive and very well tolerated with excellent results. So now let's open the.
Sure. Thank you so much, Dr. Contreras. And just a quick question. Metastasis of prostate usually they go somewhere first, or is it
Not first, commonly.
commonly? Okay, commonly.
So there are organs that are commonly affected and organs that are not commonly affected by
Can you go into
prostate
those a little?
cancer. So the most commonly affected organ is the bone structure. And so usually you will find metastases to the bones,
Okay.
but it could go any place in the body. The more uncommon would be probably the brain.
Okay.
It is extremely rare to find brain metastases to the prostate, but they do exist. The lung is also not commonly affected, or the liver, where it's very common in other type of tumors. So rarely we will find these organs affected by prostate cancer, but it can go anywhere.
It can go anywhere,
The
okay.
most common are the bones,
The
the
bones.
bone metastases.
Typically, a patient is diagnosed with prostate cancer early stages or with metastasis. What's more common nowadays?
Well, for a long time, screening was very helpful, and screening was done with a tumor marker
Okay.
called prostatic specific antigen. It's a PSA test that is normally from 1 to 4, and above 4 is abnormal. It can go up to 10 with inflammations. And so massive use of PSA was helping us do early diagnosis, but also while it provoked many unnecessary interventions.
Okay, so patients had the lab a high PSA,
Yeah.
and they would get surgical.
And they would get
surgical
procedures
recommendations.
that could even kill them.
Is surgical procedure the best first option for a prostate diagnosis?
It all depends what the stage is. So one we were talking about the aggressivity of cancer, and the other ones are the stages.
Okay.
So prostate that is localized with a small tumor, less than 2 centimeters in the prostate, is stage 1.
Okay.
Anything smaller than that continues to be stage 1, and generally is a surgery can be a curative procedure. And so it was for a while abused because it was done in patients with very low aggressivity, in 3+3. And so that prompted a number of studies that showed that the patients were overtreated. They did not need a radical prostatectomy for cancers of that type. So it's a little bit complicated how you
Okay.
choose, but
Okay.
generally, stage 1 prostate cancer can be cured
With surgical
with surgery.
Okay.
Now, that patient needed to be cured, quote
Okay.
unquote, of a cancer that was never going to kill that patient.
Mhm.
And before robotic surgery, it was a major problem because the incidence of incontinence was about 60%, and the incidence of impotency was about 99%.
That's
And
impressive. Mhm.
in young, let's say a young man, 50 years of age, will you basically ruin their life by
Mhm.
curing them. So that criteria has changed. And then now, fortunately, with robotic surgery, the incidence of impotence has dropped significantly.
Okay.
And the incidence of permanent incontinency has also diminished very, very importantly. So now patients tend to be incontinent for maybe weeks or
Okay.
less, and then they regain their capacity to retain urine. And the nerve that helps in erections, you can actually see it now
Okay.
with the cameras, and you can reduce the risk of impotency significantly. So surgery has evolved to such a point that is much safer now. So when you have a patient in stage 1 with a Gleason 7, 8, 9, or 10, then it makes a lot of sense to try to cure the patient because these tumors are deadly.
Mhm.
And secondly, because the patient very likely is not going to end up incontinent or impotent.
Okay.
Either one of those. So yes,
That's great information.
in early stages of very aggressive cancers, surgery continues to be the best treatment for them. Uh, the other thing that happens with the PSA is that not only does the PSA have to be abnormal for you to get a biopsy, which is um, a very aggressive procedure.
Usually done robotically, the pathology, or
No, these are needles that go
needles
from the perineum.
fighting a biopsy, or is it
No,
no,
and there's usually about 12 needles at the same time going into the prostate.
My goodness.
It's no
Not
fun.
pleasant. Not
It's
pleasant.
not pleasant. And of course, it has quite a bit of morbidity. Morbidity states is a term that we use that can cause side effects
Okay.
that are usually temporary, but can be very severe. Um, so we were overdoing a lot of these procedures in low PSAs because for a long time, the elevation of the PSA to go above normal just by the fact that it went up 1 point in 1 year. Let's say that the normal was up to 4, and your PSA was 4 this year, 3 this year, and the next year was 4. The patients would go into a very aggressive type of biopsy procedure. So thank God all of that has been studied very well, and now we have much better criteria
Okay.
to offer a patient a biopsy or not, and then treatment or not. But the main problem has been that most cancers of the prostate have become very aggressive in comparison to 2 decades ago, and especially after
That's what
COVID.
I mean, Oasis has been around for 60 years, and
Yeah.
we always talk about this. The aggressivity of the cancer, of all types of cancers, is just skyrocketed in terms of
Yes.
and the treatments have to evolve with it, right? I mean, it's
Correct.
one of those,
Correct.
you have to stay on top of the actual.
And try to find ways to be the least aggressive and the most effective to provide
That's a great
patients
way of looking at it.
life with quality.
Perfect, perfect. Well, we're going to start off with everybody's favorite section, the Q&A with
Thank
Dr.
you.
Contreras. I'll ask the questions, Dr. Contreras will answer. I want to say hello to all of our patients that are viewing the webinar on our.
Oh, here, yes.
How are you
Hello
doing? How
to
you
all of
doing?
you. Hello.
Also, Douglas, Greg, I see a lot of current patients that are here in the webinar. I see your names. Thank you. I see it's great. We have a very, very large audience today, and we're gonna get started with the first person to ask a question, which is Valen Cross. The question is, what is your general recovery rates versus conventional therapies?
Okay, so in prostate cancer is where we used to have our best results because normally everybody has good results with prostate cancer since they are very hormone dependent, and usually hormone dependent hormone therapy is very effective in prostate carcinoma. So most of the patients that came to us were the patients that where the typical treatment did not work. And so they already come here resistant to hormone therapy. Another treatment for cancer of the prostate that is not used very much nowadays is removing the testicles so that there's no production of testosterone. Nowadays, because the hormone blocking agents are so effective, is rarely used. But most of our patients are here with more aggressive types of prostate cancers that are now hormone resistant. And so our therapy has to dramatically change. And so in comparison to conventional therapy, our survival rates is about 3 times higher in advanced prostate cancers with high Gleason scores.
Our more typical patient that comes here at the hospital.
That comes here.
Multiple treatment prior, right?
Yes. And as I mentioned before, now there are hormone blocking agents, even in combination with chemotherapy, where the same product has a hormone blocking agent and chemotherapy.
Okay.
And although chemotherapy has not proven to be effective against cancer of the prostate, in combination with hormone therapy, it can help some patients live longer with these combinations. But usually this longevity is measured in months.
Okay.
Where our longevity is measured in years, sometimes many, many years. So in spite of the fact that cancer of the prostate has changed, has become more aggressive, our results continue to be very encouraging.
Perfect. Thank you so much for that question, Valen. You got right to it. I love it. Let me see. Dr. John, welcome back to John Montalvo. We spoke a couple of weeks back. I think you're doing a webinar with him in this.
Yeah, wonderful.
So thank you so much for the invitation, Dr. John. What lifestyle, diet, and nutrients are necessary to keep a prostate healthy and possibly prevent prostate cancer?
Well, it's very well known. There are many, many articles that link our lifestyle to prostate cancer, especially very fatty content meals, like all the SAD diet. SAD diet stands for Standard American Diet, and it is very sad. It's very tasty and enjoyable, but it's sad.
Yeah.
So.
Did you just come up with that, or is that
No. It's not. We used that term a lot many years ago.
Known it for more than 20 years. Working here 18, I've never heard that term. So you guys are lucky.
It's well known, and it's very well established that lifestyle plays a major role. So the better your diet is, the lower the possibility of you developing cancer of the prostate. Again, now it's changed a bit because there are many factors that take place in order for cancer of the prostate to be developed. But most of the cancers of the prostate are ductal, so very similar to the breast. And so low sexual activity also plays a role. Because you never clean out the ducts.
Okay.
When there's no. So there are many studies that show that men that ejaculate at least 3 or 4 times a month will have a much lower incidence of cancer of the breast.
Interesting.
So that's not as big.
Your wife.
Yes. But diet, I think it's one of the major issues.
Major issues.
And so a diet that is low fat, low glycemic index, and that it's of organically grown foods is going to be the best way for you to protect yourself from carcinoma of the prostate. There's also a number of studies that show that men that exercise strenuously 4 hours a week have a much lower incidence of prostate cancer. So what is strenuous? That you actually sweat.
Okay.
Although there are other studies that show that walking is sufficient. So if you walk half an hour a day for 5 days a week, you will get 4.5 hours in that week. And
It's very simple. Just
that protected from
work out, eat healthy.
Yes.
I mean, that's
yes.
And that's for all types of cancer.
For all types of cancer.
Yeah.
But
There's
there's no question that, and especially in breast cancer and prostate cancer, it has like a larger impact.
Okay. So specifically for prostate cancer.
Not specifically, but I mean, it's helpful for any type of disease.
Okay.
For that matter, especially heart diseases and all of that. But the impact on the incidence is higher prostate and breast. So, for instance, women that exercise 4 hours a week will have about 50% less chance of developing breast cancer, and probably in the colon is going to be 30% or 35%. So diet also,
and men that do exercise is about
70, about the same.
About the same, or
about the same, about 50-55%. But it's a tremendous.
It's huge, yeah.
So if you add then diet has another 50%. So a friend told me, I'm not going to tell that to my mother-in-law, because if she eats correctly and she doesn't, she's going to live forever.
She'll live forever, yeah. I can't say that about my mother-in-law, so.
Because it's my wife.
Exactly, yes.
So yes, lifestyle is a major enemy of cancer or of developing cancer if you do the wrong things.
Got it.
Smoking, drinking alcohol, in excess, they all play a role.
All righty. We have a question on melanoma, and we're okay answering questions about
Yes,
this type of
about
cancer.
other
So feel
cancers.
free to ask about any treatment, any type of cancer, anything. It's fair game here for all questions. This is focused on prostate cancer, but we know that we have a large audience. So Farkad is asking, it is actually for my brother who got melanoma on December 2023. He was treated and he was cancer-free on June 2025. And 2 weeks ago, they found cancer all over his body, liver, lungs, bones, due to the medication that was given, which weakened his immune system. It was cortisone and infusions because he had tuberculosis. Is there treatment here for that?
For tuberculosis?
Well, no, I mean, no, they found cancer all over his liver, lungs, and bones.
But it was triggered, I understand, by the
Yes.
treatment against tuberculosis.
Exactly, yeah.
Well, melanoma's treatment has evolved significantly. Chemotherapy is of very little value or no value whatsoever. And so in conventional terms, there was very little to offer until checkpoint inhibitors came along. And so melanoma is probably where we have the most experience using immunotherapy, conventional, with very good results. So I'm assuming that when he was treated, either it was an early stage and was removed and he was free of cancer, you don't mention that, or that if he was advanced, that he received these immune therapies with very good results. And then unfortunately, because of the tuberculosis and the inflammatory processes that tuberculosis can cause, your brother had to receive high dose and probably for a long time of steroids. Cortisone. And cortisone is a well-known immune suppressor. And so that counteracted probably the treatment that was effective, and this is why the tumor came back. If now the problem of the tuberculosis has been solved, treatments for tuberculosis nowadays are quite effective. They take a long time, though. It's between 6 months and a year that you need treatment. And but there are some types of tuberculosis that are extremely aggressive, and they're resistant to all of the antibiotics because it's such an old disease that there are tuberculosis that are going to be resistant to all antibiotics. So it's complicated, but if you can send us more information, more detailed information about the type of tuberculosis, the treatment received for the tuberculosis, if the tuberculosis is already in check, and we've treated many patients with this history that they responded very well initially with recurrence, and our impact protocol has proven to be very effective in this type of patients. Again, it's important to know if he has to continue with the steroids or not. So if you don't mind calling us, and either myself or one of my doctors will consult, review all of the information, and then we'll get back to you with a proposition recommendation of treatment for your brother.
Yeah, Farkad, like Dr. Contreras said, go on our site, fill out one of our contact forms, or call us. We have admissions coordinators standing by to help you, and we can give you a free Zoom consultation with one of our doctors as soon as you send us your medical records and everything. And that was for everybody, all participants. Just let us know how we can help. Dr. John Montel, you have another question. He's going to get us in trouble because he wants to know about vaccinations and seeing more aggressive tumors. So if we answer that question, we're not going to be able to put this on YouTube, but let's go ahead and answer for our audience.
Well, there's no question that after COVID, we noticed a tremendous increase in
the turbo cancer is the famous.
Well, the turbo cancer refers to the fact that now we have much more aggressive.
Okay, good. So it's aggressivity, not in terms of,
but incidence as well.
Okay.
So we notice an increase in incidence, a decrease in age. So cancers that typically would happen in patients after 60, like colon cancer. We had a patient that was 16-year-old, a 16-year-old with colon cancer. It's still mind-boggling because cancer of the colon at least takes 8 years to develop. So for somebody that was 16, it's amazing. So I do believe that either the bug, but most likely the vaccine is playing a role.
Okay.
We had patients that were very stable with their cancers or free of cancer that were vaccinated, and their cancer just
came back,
flourished. We had patients that came with very non-aggressive cancers, some even quite benign malignancies, and they turned into very aggressive cancers.
Is it because of the altered state of the immune system?
Well, the only thing I can say, doctor, is that this is observational.
Okay, yeah.
I have no studies showing that the cause was either the virus or the vaccine. But it's many people say that they don't believe in coincidences. This would be very coincidental that the COVID problem did not have an impact when all of this appeared.
Yeah.
After our battle against the COVID virus.
We can speculate.
So it is observation.
Yeah. Thank you for that, Dr. John. Stephanie's asked, I'm going to go to the Q&A. Well, Elva is asking, how true is that people who are not sexually active are more likely to develop cancer? We kind of answered that, right?
Yes.
Yeah,
it is true. Again, because the ejaculation has a cleansing effect on the ducts,
Okay.
such as breastfeeding would have on the breast. So the first name for cancer of the breast historically was the disease of the nuns, since nuns never got pregnant,
That's interesting.
they never breastfed. It was found that nuns had a much higher incidence of cancer of the breast than the rest of the population. And so, yes, it is true. It is well established.
All right. Keith is asking, I was diagnosed with prostate cancer in March 2022. Followed the Chris Work protocol for 3.5 years. I imagine it's more of a nutritional protocol. I did 10 rounds of radiation to pelvic floor on September 2024. Started chemo in April 2025, stopped by July 2025. Went to Canada to the Healing Oasis I think he just got back in September. CT scan showed today it grew about an inch since 6 or 7 weeks ago. My oncologist suggested Pluvecto. What do you think?
What did you recommend?
Pluvecto.
I have no
I
clue.
imagine it's kind of like a checkpoint inhibitor.
It could be one. No, I definitely.
Immunotherapy?
No, it
Immunotherapy.
doesn't. It doesn't. Look it up. I have no experience with that medication at all. It could be one of those that I mentioned to you, where there's a combination of hormone therapy and chemotherapy. Um, uh, as soon as Gaston.
Yeah, give me 1 second.
But those are the typical cases that come to us, and we've had very, very good results. If you can also let us know what the Gleason score was, I can tell you a little bit more.
Hold on. It's targeted radioactive for
Oh, so it's a radioactive drug.
castration-resistant cancer.
Yeah.
That has spread to other parts of the body.
Okay, so it's one of these new ones, but this is based on radiation. So
Radiogland therapy.
So what happens is that these are usually based like on a PSA, where they will give you this product and it guides, because of the PSA, directly to where tumors are. So there are new therapies, especially for bone metastases, that have been very effective with this type of radiation.
Yeah, so it's injected into the vein,
Yeah.
travels to the body, and
So
attacks to PSMA positive cancer cells.
Correct. So the
Yeah.
it guides. So the PSMA is a test that we use for PET scans. And because many of the prostate tumors are not sensitive to the typical FDG use on PET scans. Another radioactive material is used called PSMA.
Okay.
And the PSMA is very specific for prostate, because it goes to wherever prostate tumors are.
So it
lights up the prostate cancer. So what they do is they tab this radioactive elements into the PSMA, and so it will go to wherever the tumors are only.
Sounds interesting.
And so I believe that it's a very good option for you. I've been trying to do this here in Mexico. It has finally been approved. Well, it was approved last year. It's terribly expensive. One treatment is about $50,000 in the USA. In Canada, is going to be offered by the state. So it's a very good option. The toxicity is very low because the amount of radiation is low, and because it's so targeted, you don't need to use high amounts of radiation. And yes, so I would recommend it, definitely.
Teresa is asking, do you feel there's an emotional, spiritual component to prostate cancer? I heard this viewpoint in German New Medicine that prostate cancer is related to unprocessed loss of loved ones. If so, have you incorporated spiritual healing as part of a protocol? We're all about emotional, spiritual.
Yeah, there's no question. There's a study by a German doctor, maybe that's the one that you're referring, and he has some very interesting claims based on some scientific
like
fact
emotional trauma.
that there's a very specific emotional trauma for almost each tumor. So I don't remember. I'm going to give an example that might not be related to what it says, but that if you lose a daughter, you will get breast cancer of the right side.
Okay.
If you lose a son, you will on the left side. I'm exaggerating, okay? But this is the way he explains it, and he has a lot of data to back that up. So there's no question that emotions play a role. I am not so convinced that it has to be so specific. I think that emotional trauma can affect your immune system in such a way that tumors can appear. It doesn't matter where, but that they do have that an emotional trauma has a very significant effect on the immune system. And when your immune system is not working, you are going to be open for the development of cancer.
Yeah. So
So for instance, I'll give you two studies that I have mentioned several times because they're easy to understand. There are some that are very complicated, but they make a lot of sense when you know neurology. But there was a study done in the 80s of college kids that they took them to see a movie. And 50 of the 100 kids saw a very uplifting movie. Before they went in to see the movie, they drew blood and they measured CD4, immune elements, cells that are very specific to protect you from cancer. And the other 50% saw a very depressing movie. At the end of the movie, 1 hour and a half later, blood was drawn again. And the kids that saw the uplifting movie observed or experienced a significant improvement of their immune system overall.
So their CD4s and CD8s went up. So it created more
cells.
More cells. Okay.
And the kids that saw the depressing movie had a significant decrease in those cells. And this is an impact of 1 hour and a half. So imagine you lose a loved one. That stays for the rest of your life. And for months or sometimes years, it is depending on your spiritual fortitude. It can be very devastating. So there is no question that the emotional trauma opens the door for cancer. What do we do about it? Well, that is what my father started in the late 50s, early 60s, when there was no alternative therapies per se. He was a very renowned oncologist in Mexico City, and he was the director of a major oncological center in Mexico City in the military hospital. My father was a military doctor, and he was the pathologist and the oncologist there. And he noticed that the reason for, well, he theorized that the reason for the failure in oncology was that we were only taking care of the physical entity of the patient, and we're not paying attention to the emotional and spiritual needs. And so he started basically preaching to patients and letting them know about Jesus. And I think he was the first one, at least in Mexico. There was somebody before that started emotional therapies. And the very basic, laughter therapy.
Like Patch Adams.
Yes. So Patch Adams and my dad became friends because of that. So Patch Adams found out about my dad doing laughter therapy. My father wasn't as funny, so he started with very simple things, addressing the emotional and spiritual needs of patients. And I strongly believe that one of the main reasons for our success is based on the fact that we will provide our patients not only with resources physically, medications and diet and all of those things, but that we provide our patients also with emotional and spiritual resources so that their immune system can be strengthened. And so my father's basis for this was really immune therapy. And in the 50s and 60s, we had no clue about these studies that I'm mentioning now. Now there are a lot of very sophisticated studies that show the tremendous impact that emotions have on the immune system. So yes, we address the spiritual and emotional needs of our patients, and I strongly believe that there are as important or even more important than the medications, natural or unnatural, that we give to our patients.
That's beautifully said, Dr. Tres. I'm gonna let Dr. Tres drink some water. I'm gonna talk about Dr. Contreras' latest book. It's called The Art of Undermining Cancer, and you can download this for free on our website at oasisofhope.com. And also, Dr. Contreras wants to give away how many books to all the attendees, Doctor?
Well, it was 15.
15. All right. So, all right. Lucky participants in today's webinar will get an email from me. And if you just send me your name and the address or the person you want this dedicated to, Dr. Contreras will personally sign the book for you guys. Also, again, I just want to touch again on the fact that we offer free, I'm just falling, free Zoom consultations to all patients that are interested in coming to Oasis of Hope. All we need you to do is go online, fill out one of our contact forms, call us, or fill out a questionnaire online. All we really need is the medical records, and we can set you up with a free Zoom consultation, about 45 minutes, with either Dr. Contreras or one of the attending physicians that work with the admissions department. And from that, we give you a recommendation, a personalized protocol that's created by Dr. Contreras' team. And if you decide to trust us with your medical care, you fly to San Diego, we pick you up, bring you down to our cancer center, and we treat you, we love you, we hug you. We're Mexicans, so we're very warm-blooded people. Yeah. And like Dr. Petra said, we're a ministry here. We're not just a center, and we have purpose, God purpose, and our mission is to help patients from all over the world, from all walks of life, with the most innovative, integrative cancer care there is available right now. So if you have any questions about talking to a doctor, please call us, but we'll continue with the Q&A.
Yeah.
Thank you so much sorry for the intermission. Another good question. We always get this question. Ivermectin, mebendazole, and fenbendazole. What do you think about that for prostate cancer?
Well, there's no question that both these anti-parasitic drugs have an effect against malignant cells of all types. There's a lot more information on fenbendazole and mebendazole than ivermectin. Ivermectin is fairly new since COVID. So both drugs have proven to have some anti-tumor effect, and I would not discourage you from taking them. There's no evidence to date.
There's no dosage. There's no kind of like this is the protocol for
we just don't know. We are using the protocol against malignancy. Just about everybody else that was proposed for the prevention of COVID, which is a very high dosage of ivermectin in comparison to the dosage that is used for removing parasites from your body. And so that's the protocol that is mostly used around the world for the treatment of malignancies with ivermectin. But again, the information is scant. I wouldn't discourage you because there's virtually no side effects. We were somewhat afraid of what the impact would be using such massive dosages. Mm-hmm. But we did here at the hospital. I was against vaccines, so most of us did not get vaccinated. So we followed. I offered to all of our personnel the protocol that was published for prevention. And I would say that about 70% of us did not get vaccinated. We used this protocol and we're all alive. We're all fine. Some did develop COVID. I didn't, not at all. And most of us did not get COVID. And the ones that did get it was very mild. but we did the test and it was proven to be COVID. And so this is a very high dosage. And so we took it between, depending on who took it, between 6 and 9 months at extremely high dosages. And we're all alive. And none of us, all the blood tests were completely normal. So we saw no adverse effect. The tolerance was great. Nobody had any issues with tolerance at those dosages. And I would not discourage anyone to not take it. But what I can, of all the things that we do here, we have substantial data to support the use as an anti-tumor agent or an adjuvant to anti-tumor therapies. But from these two, there's again from fenbendazole and mebendazole, you will find some publications in the literature that support the anti-tumor effect. From ivermectin, I haven't seen. Maybe by now there's more, but I haven't seen any.
Well, our scientific staff is continuing to look at the data on a weekly basis. I mean, it's one of those things where when we see that there's a positive effect and we can integrate into our protocol in a seamless way, I mean, I'm sure that we're going to have it here, hopefully. But if we don't see the benefit, that's where the benefit, cost benefit, that's where we
Yes.
see our always. We want to do what's best for the patient, what's beneficial for the patient, and not just add for the sake of
adding.
Yeah,
And the other reason why I hesitate to add it is because our nutritional protocol that it's not only dietary, but that it has supplements and nutraceuticals is very comprehensive. And so it's very easy for a patient to develop gastritis or intolerance to so many elements. And so I first tell our patients that if they tolerate our protocol completely without any issues, then it would be okay to add
won't hurt.
other elements.
Won't hurt.
Yeah.
Won't hurt. Okay. Time is flying. It always flies. It always flies. Quick question. Gary's asking, is an enlarged prostate a precursor to cancer? I know you touched on that in the beginning.
Yeah. No, not at all. Not at all. Everybody will develop hypertrophy of the prostate or enlargement of the prostate. And as I mentioned, just about everybody dies if you live long enough. The theory says that you will develop prostate cancer. But no, to date, it's concerning that you have an enlarged prostate, and it should be hopefully treated so that you do not have urinary problems. But it does not mean that because you have an enlarged prostate, you will develop prostate cancer.
Funny question. Mary Ellen is asking, what do you feel about drinking beer? I don't know, you've never drunk a beer. I think that's a first in your life.
I've never drunk anything because the taste is.
My friends won't even believe me. He's like, he haven't drink in his life. I'm like, never a drink. And
I just don't like it. But there's no question that alcohol is related to prostate cancer more specifically than other type of cancers. Now, beer, I would have to review that.
Well, the alcohol level is pretty
because the level of alcohol is very low.
I wouldn't know that, but
and especially in Europe is basically considered as a soft drink. So that, for instance, in Disneyland, I'm almost sure that Disneyland in Paris or in France serves beer, whereas here it's not, right?
Exactly. In Germany, I mean, they drink beer.
Yeah. So the alcoholic content is lower, but the glycemic index is very high, and everything with a high glycemic index puts you at risk with any type of cancer. But alcohol specifically for prostate cancer is more of an issue. Than with other. But again, beer, I don't remember. Definitely harsh or hard alcoholic drinks. And some wines Most wines also have a lower glycemic index. So wine in moderation has never been a problem.
It's good for the heart.
And for many other things. And that's why I tried it once or twice, but it's just.
Is it the same as grape juice and wine? Difference?
Well, I think grape juice has a higher glycemic index. I think I have to recheck that.
Well, the sugar turns into alcohol. That's why. Yeah. Okay.
Please check if beer
it
has the same impact as other alcoholic beverages.
Okay. Let me see. Christina's asking, what treatments do you offer for prostate cancer that has metastasized to the bone and is very aggressive? My prostate cancer is hormone resistant. I'm currently on a trial with mevrometostat and Xtandi.
But Xtandi is one of the new ones. It's very harsh. Usually the tolerance is low. And again, as I mentioned before, most of our prostate cancer patients are in that condition. There's a type of patient that comes to us, and our results have been very encouraging, especially since we started our impact protocol. And so if you're suffering and the tolerance is poor and the results are not very good, I would encourage you to consider our therapy, which is very well tolerated and the results are better.
All right. It's a good question. I mean, this first time we get this question. Dental work and cancer, implants, root canals. I mean, is there a link between dental work? I mean, I know mercury.
Oh yeah, there are a number of published studies that show that patients with amalgams. Now you kids, you don't even know what that is. They're not used anymore, but all of us that are a little bit older had amalgams, and I definitely recommend for you to remove them and exchange them for the new resins that are plastics, and they have a much less negative impact on the immune system than not. Root canals can be a problem because they leave the tooth root and it's dead. Okay. That's why you have no more pain. And that opens the possibility of an infection. And it's a mild infection that provokes no symptoms, but it's constantly bugging the immune system and distracting the immune system.
Okay.
And so, according to a number of publications, the first one I think was from Austria, that showed that there was a very well-established link between higher incidence of cancer when you have amalgams or not. And so if you are of that age where you still have some metal, gold is usually not a problem. But if you have gold and other metals, the combination of metals is not good. Gold is okay, but if you have any other type of metal, I would encourage you to remove it. Now, implants, the least reactive metal is platinum. And most of them are platinum. There are some new ones that are ceramic. And so the more, either one is not closer to nature, but if you're going to have metal, it should be platinum or the newer ones that are made of ceramic are much better. Ceramic have some drawbacks because there are sometimes that you will need more than one one post, and then ceramics cannot be used, and so you would have to go to the platinum.
Okay.
But those are the least aggressive. Okay. If you can avoid them, is the best.
We do offer free dental consultations with a doctor here locally that does the Higgins protocol, which is very natural. Very natural. They only use like organic products, stuff like that.
Biodentistry.
Yes. So yeah. So if you have that issues, just go with somebody that's biodentistry.
And we do that because I do believe that it's very important. The health of your mouth has to do with your whole health.
Okay. Zam is asking, it's for his son, 3 years old. My son was diagnosed last year with neuroblastoma stage 4 high risk metastatic. He's done Cyopen protocol, rapid Kojak treatments. He's doing immunotherapy right now. He's getting cortisone as well.
So that's a very complicated problem because he needs the cortisone to reduce the edema in the brain. And so it's working a little bit against the immunotherapy, but immunotherapy offers the best possibilities for your son. And so I would encourage you to continue with that. We have no pediatric specialists in oncology here. And so we do not treat children. Our experience with children is basically nil because we start treating children from the age of 18 or over. Sometimes we will accept children around 16, like the boy that I mentioned before with cancer of the colon. But generally, we do not treat children.
Okay. Lori is asking, for an 85-year-old with recurrent advanced prostate cancer after both surgery and salvage radiation, PSA is now rising again, but scans are clear. What are realistic treatment options for the best quality of life, if any? And what are the odds of having something else prior to needing palliative care?
So if there's no sign of the cancer, it means that it's still microscopic. It has to be there because if he had a prostatectomy and then radiation, the PSA should be 0. So anything and the only thing that can promote the production of this antigen,
the PSA,
is tissue of the prostate, wherever.
But if he has no prostate,
then the tissue has to be somewhere else.
Okay.
And so any rise means that there is activity. A treatment like ours is usually very well tolerated and does not deteriorate the quality of life at any age. But I agree that at 85, well, you want to be very conservative and not mess up with the quality of life, which is the most important thing, especially when the cancer is not visible. So a protocol like ours could be very, very effective to prevent the enlargement of these metastases so that hopefully So I hope you heard everything that I was mentioning, that at 85, quality of life is paramount with a very little problem because there's no evidence of disease yet. But the fact that the prostate is rising is definitely a red flag, and a treatment like ours would be more than sufficient.
We look so much different on this, but yes, thank you for that question. Let's see. Okay, it's 5. 2 more questions, doctor.
Okay.
And then we'll leave because we want to be we want them back. And the more questions we ask, let me see. Have high inflammation due to Crohn's and metastatic prostate to L1 to 5 plus lymph nodes. Is there any treatment available?
Yes, I don't know how you're treating your Crohn's disease, and that's like in this little boy that was being treated with immune therapy and immune suppressing agents. The most effective treatment for Crohn's disease are immune suppressing agents. So it will depend on the type of immune suppressant that you're using and the amount, whether our impact protocol will be effective or not. But the rest of the therapy can be very, very effective. And as I mentioned before, it's very common for prostate cancers to develop bone metastases.
He says no treatments for Crohn's.
Oh, no treatment. Then you are a perfect candidate for our therapy.
Yeah. Due to Crohn's, high inflammation due to Crohn's and metastatic prostate cancer.
Okay.
Yeah.
So our therapy is going to help you quite a bit with the inflammation of the Crohn's disease as well. And the impact protocol is not specific for autoimmune diseases, but it has an immune modulating effect that could probably help you as well with the Crohn's. We've noticed that with patients with lupus, for instance, that they don't need to continue with any of the immune suppressants after our therapy. So it could help you with Crohn's. I don't remember. We've had patients with Crohn's disease and cancer before, but I think it was before we had the
The
vaccine.
vaccine, yeah.
It's not common.
Yeah, because it really helps out with autoimmune
Yes,
and
it can.
it
Yeah.
can, right? Yeah. So
In fact, we are in the process of developing dendritic-based immunotherapy for autoimmune diseases. The process is different than from cancer because there are two families of dendritic cells, and so we usually have a combination of them, and one is immune active and the other one is immune suppressive to maintain a balance. So we overstimulate the ones that are anti-cancer and understimulate the ones that are immune suppressant. And so what we're working on and developing is to do it the other way around for autoimmune
yeah,
diseases.
we get a lot of people asking for
Yeah.
autoimmune diseases. So we're coming out
That's why we're working on that.
Yes, yes, yes. Okay, last question. A tough one to choose. Tough one to choose. Okay, we can either do about beta glucans or about photodynamic therapy.
Photodynamic therapy is a very interesting thing. There's no question that some types of light will destroy tumor cells. And there's a number of published studies that you can stimulate the malignant cell and then, depending on the type of light that you use, then expose the tumors to light and the tumors will be destroyed, like with radiation therapy, but without radiation.
Is that the photo beam?
Yeah.
Okay, yeah.
The problem has always been, how do you get the light to the tumor? And so there, in fact, we did a study with
yeah.
photodynamic elements with lasers
I know,
for the
yeah.
first time.
For COVID patients, yeah.
And
for
so
cancer patients,
as far as the COVID, the immune simulation was fantastic.
Fantastic, yeah. So
The results against the side effects of the neurological impact that people can't smell and can't taste,
long COVID, yeah.
they all went away. So we have not found any light therapy or photodynamic therapy to be very effective in patients with a number of tumors around their body, because it's just too difficult to get the light there. Just putting the patient under the lights,
it takes a while, yeah.
It doesn't work. And if the tumors are very deep, it's not going to work, and so you can't put the light. But I'm very interested in photodynamic therapy and also with electromagnetic fields, and I believe that once we find a way to get these elements to where the tumors are, that the therapies are going to be very, very effective. So I've been looking for people to develop therapies like this, and whenever it's possible, we'll try them.
Yeah. Well, if you know anybody that developing them, tell them to give us a call. Everybody, we want to thank you so much for being our guests tonight, or wherever you are, in the morning or in the afternoon. We want to thank you from the bottom of our hearts for joining us, and we want to give you a good evening, good morning, good afternoon, and we are going to be back in 2 weeks. And our upcoming webinar is on natural killer cell therapy, part of our impact program. And we're gonna have a video and a presentation, another Q&A section with our attendees. And this webinar will be on tomorrow on Facebook and latest on Monday on our YouTube channel. We just have to edit out the parts of some parts, yeah, because they take it off and it's always a mess. But from Tijuana to the world, to the US, to Canada, to saw some people from Scotland, and to our current and former patients that are online with us, and to our infusion center patients here at the hospital, we want to thank you for visiting us today. We love you. We send we send big hugs, and we'll see you in a couple of weeks. Thank you, Dr. Contreras, for joining us.
Thank you very much. God bless you. God bless you.
Bye-bye.